Hi, my name is Claire Eland from the Royal Children's Hospital in Melbourne. Together with Dr. Peter Francis, we have undertaken research to determine the effect of fasting ketosis on brain FDG uptake in children and adolescents. The brain primarily utilizes glucose for the generation of ATP. In situations such as prolonged fasting, ketogenic bodies such as B-hydroxybutyrate and acetoacetate become an important source of energy for the brain. The brain's utilization of ketones depends mainly on the concentration of these bodies in the blood. Therefore, many dietary approaches such as ketogenic diets, ingestion of ketogenic medium-chain fatty acids or exogenous ketones facilitate significant changes in the brain's metabolism. The analysis of regional cerebral glucose metabolism, also known as FDG uptake, is an important component of the interpretation of pediatric PET brain scans. Regional differences may be seen in a variety of pathologies such as seizures, developmental disorders, encephalitis, genetics, and injuries. It should be noted that during the analysis of cerebral uptake, comparison to a normal age-appropriate uptake database may be involved. It has been previously demonstrated that glucose uptake in brain regions varies with age and maturation. The aim of our research was to determine whether the ketosis demonstrated by the fasting state for an FDG PET scan was sufficient to create a significant change in cerebral regional FDG uptake that may change the interpretation of brain FDG studies. Children and adolescents between the ages of 4 and 18 who underwent an MR PET study were identified using the Royal Children's Hospital database. Patients who were awake, non-anesthetized for uptake were included. Patients were undertaking the PET study for a variety of indications such as oncological, epileptic seizures, infection and inflammatory conditions. Patients with known cerebral tumors were excluded. Fasting times ranged from 4 to 24 hours. Blood sugar levels and blood ketones were measured prior to FDG injection. Patients requiring a general anesthetic for the study were anesthetized at least 30 minutes after injection of FDG. All patients underwent PET-MR imaging using a Siemens Biograph MMR scanner. Automated regions were then obtained for the frontal, parietal, temporal, and occipital lobe, as well as the basal ganglia. Regional SUV max was measured using the Siemens Syngo-VR neuroanalysis application. SUV max for the respective regions were plotted against blood ketone levels with trend lines generated. The analysis was divided into two groups, 4 to 10 years of age and 11 to 18 years of age, as it has been shown previously that regional cerebral metabolism changes with maturity. There were 55 individual patients available for analysis, 18 in the age group of 4 to 10 and 37 in the age group of 11 to 18. Blood glucose levels were in the normal range for all patients. In the age group of 4 to 10 years, ketone levels ranged from 0 to 3.8, with an average of 0.51. In the 11 to 18 age group, ketone levels ranged from 0.1 to 1.4 with a group average of 0.3. The creation of graphs and plotting regional uptake against ketone levels showed a non-significant change in SUV values as blood ketone levels increased. Here is a table summarizing the mean and range of SUV max values for each age group for 3 regions of the brain, including the basal ganglia, frontal lobe, and parietal lobe. The slight increase in SUV max average between the age groups is in keeping with the expected change in uptake with maturation. In the 4 to 10 year age group, the mean SUV max values for the basal ganglia, frontal and parietal lobes were 12.4, 12.59 and 12.7 respectively. In the 11 to 18 years age group, the mean SUV max values for the basal ganglia, frontal lobe and parietal lobes were 14.8, 16.2 and 15.6 respectively. Here are a couple of graphs demonstrating the trend lines for SUV max versus ketones for the 4 to 10 year age group. As you can see, as blood ketone levels increase, there is a non-significant increase or decrease in SUV max values. Here are the graphs demonstrating the trend lines for the 11 to 18 years age group. You can again see here that there is not a significant change in SUV max values as blood ketone levels rise. In conclusion, our analysis confirms the normal increase in regional cerebral glucose usage with maturation. The degree of ketosis associated with a short fast of 24 hours or less does not significantly affect the uptake of FDG sufficiently to require correction in the analysis of cerebral FDG PET studies. This concludes my presentation. Thank you so much for taking the time to listen.